Well, good morning everybody. We might as well get started. Welcome to the first session for Cancer Grand Rounds for 2014. Today we're very pleased to invite Professor Jane Phillips to give the first lecture for the year. My name is Robyn Ward, for those of you who don't know me. It's Haematology's turn to chair Cancer Grand Rounds for 2014, and I'll be chairing for this year. This morning, I'm going to ask Robyn Ward to speak first of all. She's going to give us a little update on what's happening with the Cancer Centre, and then she's going to introduce the concept of the Cancer Challenge of the Year, of which Professor Phillips' group was the inaugural Cancer Challenge of the Year through the TCRN, the Translational Cancer Research Network. We're looking forward to the update, and Robyn will tell us how people can get involved in subsequent challenges of the years through the TCRN.
So thank you, Vivian, and just a note of thanks to Elizabeth Hovey, who chaired Cancer Grand Rounds for 2013. She did a great job, and I'm sure Vivian Chen will do likewise for 2014. So I don't have any holiday snaps, so what I thought I'd do is just show you a few things that have been happening behind those hoardings that you see up on High Street and Avoca Street. So that should just scroll through, but while the slides scroll through, which takes us through what's been happening behind the hoardings over the last 15 months, I wanted to mostly highlight some of the things that are going to be happening this year. Now, the main thing that will happen by the end of this year is that we'll be moving into stage 1 of the new cancer centre. And stage 1 involves the bunkers and the linear accelerators which sit within those bunkers for the treatment of cancer patients. Now, the reason I mention the linear accelerators is because that's a big undertaking to get the linear accelerators set up in the radiation oncology bunkers. The building will be partly occupied by us come around April-May this year, and from about April-May till October we have the very challenging task of getting the 3 LINACs up and running, and that involves getting one of them moved from where it currently resides, Bondi, moved from where it is in building 3 into the new building, and then 2 brand new linear accelerators installed into the other 2 bunkers. So from about April to October, Michael and the team in radiation oncology are going to be extremely busy. For the rest of the Cancer Centre and for people who are needing to refer patients for radiotherapy, it's going to also be a challenging time because we won't be working on 3 LINACs. We'll hopefully be working on 2 all the time, but there is a possibility we may only have 1 LINAC working at any particular period of time. So remember that when you're sending patients down between April and October, but by October we should be fully functional in the new Cancer Centre stage 1. What happens between October and the end of the year is that the building 3 will be demolished. That means again an impact on radiation oncology, so Michael will lose his office, as will some others in radiation oncology, and we'll be moving back towards building 2 into a much more cosy relationship with everyone until the final building is built. So I think these slides are nearly done, but you can see what a very big hole, and there's Mike looking very proud in front of his bulldozer. While they continue on, I just wondered if anyone had any queries about what's going to happen this year, or indeed how it might impact on them. I know there aren't a lot of people here today who are actually treating patients in the Cancer Centre, but for anyone who does have any questions, feel free to ask, otherwise we'll let the slides